Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about statins may lower the risk of bleeding stroke according to study. People who take cholesterol lowering drugs called statins may have a lower risk of having a type of stroke called an intracerebral hemorrhage according to a new study published in the online issue of Neurology. The lobe area of the brain includes most of the cerebrum, including the frontal, parietal, temporal, and occipital lobes. The non-lobe area primarily includes the basal ganglia, thalamus, cerebellum, and brainstem. For the study, researchers looked at health records in Denmark and identified 989 people with an average age of 76 who had an intracerebral hemorrhage in the lobe area of the brain. They were compared to 39,500 people who did not have this type of stroke and were similar in age, sex, and other factors. They also looked at 1,175 people with an average age of 75 who had an intracerebral hemorrhage in the non-lobe parts of the brain. They were compared to 46,755 people who did not have this type of stroke and were similar in age, sex, and other factors. Of the total participants, 6.8% who had a stroke had been taking statins for 5 or more years, compared to 8.6% of those who did not have a stroke. After adjusting for factors like high blood pressure, diabetes, and alcohol use, researchers found that people currently using statins had a 17% lower risk of having a stroke in the lobe areas of the brain and a 16% lower risk of stroke in the non-lobe areas of the brain. Longer use of statins was associated with a lower risk of stroke in both areas of the brain. When using statins for more than 5 years, people had a 33% lower risk of having a stroke in the lobe area of the brain and a 38% lower risk of stroke in the non-lobe area of the brain. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.